Assalamualaikum warahmatullahi wabarakatuh. Hi everybody, I'm Salsabila Noviana. You can call me Salsa. I'm a nutrition student from the Health Polytechnic of Semarang. Today, I'm going to give a presentation about chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease is a disease that is widely known in the world and has a significant impact in all aspects of affecting the quality of life of patients. Chronic obstructive pulmonary disease patients need long-term care, so patients experience a lot of physiological stress, both financially. Therefore, we need a treatment method that can reduce this aspect, especially in areas that like limited resources. Various information technology innovation have been developed in improve the quality of remote nursing service. This technology is very helpful for the health team in condition assessment, making diagnosis, planning, evaluation, and promote health through a web page that can be opened by the patient family and the entire care team. One of the technology offered is chronic obstructive pulmonary disease nutrition, which has the potential to help patients get information about good nutrition for chronic obstructive pulmonary disease patients. Therefore, here I will discuss, which includes several parts, namely the understanding of chronic obstructive pulmonary disease and the application of chronic obstructive pulmonary disease nutrition. Chronic obstructive pulmonary disease is a chronic lung disease consisting of chronic bronchitis and emphysema, or a combination of both. Chronic bronchitis is an airway disorder characterized by a chronic cough with phlegm from at least 3 months a year for at least 2 consecutive years, not caused by other diseases. Emphysema is an anatomical lung disorder characterized by widening of the distal air cavity of the terminal bronchioles, accompanied by damage to the walls of the alveoli. According to Black, GNM, and Howe, smoking is the main risk of chronic obstructive pulmonary disease. A number of irritants present in cigarettes stimulate excess mucus production, causing damage the function of cilia, causes inflammation, and damage to bronchioles and alveolar walls. For this reason, people must avoid smoking and maintain a good diet so they don't get COPD. Scientists and health experts who have identified digital tools in the form of applications that can help patients deal with lung disease, one of which is chronic obstructive pulmonary disease nutrition. This application helps patients to manage their own nutrition through nutrition using interactive tools. This app provides important nutrition information of patients with this condition in an easy to understand way. There, the patient can see what food are recommended and food that are not recommended. This application also allows patients to know how many calories to eat to maintain body weight by filling in age, gender, weight, and height. Another amazing function of this application is that patients can record what food are eaten in a day and record them. Then they can use this note to the doctor and together improve the patient's quality of life. In addition, this application can test knowledge about that chronic obstructive pulmonary disease and nutrition are in a funny way through small and fun quiz. Some information which may not be applicable to other counties due to variances in medical practice and drug prescribing and indication. This patient education app provides patient and healthcare practitioners with easy access to information about chronic obstructive pulmonary disease. One of its implementation is the development of remote service for the nutrition chronic obstructive pulmonary disease application for chronic obstructive pulmonary disease patients who are in a race with limited resources. Apart from being easy access to everyone, wherever they are, they can still have the same opportunity to get health service. In conclusion, chronic obstructive pulmonary disease nutrition has the potential to be applied, especially with chronic disease patients such as chronic obstructive pulmonary disease who experience care at home and in a community environment. Chronic obstructive pulmonary disease nutrition applications are easy to get because people are used to using smartphone. The use of chronic obstructive pulmonary disease nutrition can support the quality of home care service, especially in areas with limited resources, such as in rural areas. That's all from my presentation. If you have any question, please leave your comment. Thank you and wassalamualaikum warahmatullahi wabarakatuh.